great case today because my patient's been coming to me for a long time just for anti-aging and rejuvenation. She has some mild scarring. You guys can see some textural issues right here, some little bits, but they've improved a lot doing a combination of halo laser, skincare, profractional, and some Sculptra. She does this as her regular maintenance treatment. So today we're doing our anti-aging halo profractional combination for those that want some skin tightening, for those that want textural improvements in their skin. You guys know halo is one of my favorite treatments for rejuvenation because it does dual wavelength at the same time. It's the only hybrid fusion laser that we use in the United States with efficacy, showing results, deep 1470 for long-term collagen production and tightening, superficial erbium. You guys can see all those little dots are going to exfoliate on the skin, improving the texture, decreasing the pores, and helping her scars. We're going to combine that with a stronger erbium resurfacing called Profractional today, also on the same platform from Cyton, an amazing device, but it's more aggressive. So this downtime here, which I'm doing a strong treatment, it'll be about 3 to 4 days of speckling and peeling, adding the Profractional, maybe 3 to 5 days. She's done it before and did really well. She literally follows every skincare step, which I love. That's why she looks so much younger than she is. And it's just great. I'm very happy with her overall results. You guys know emeragecosmetics.com. We have our skincare consultations you can do, and also our skincare treatment plans. There's actually a non-ablative and an ablative protocol on there with products from my line, Antiage, Jan Marini, and some others to help you heal faster. Lastly, we're going to be doing what?
I have some questions coming in.
Oh, go ahead. What questions we got?
People want to know how much. Send us a DM, full name, email, phone number. We'll reach out. Depends on how much treatment, what areas we're doing. People want to know when we're coming back to New York. We'll be back there in May, guys.
We have the dates. You got to book it now because it's already pre-booked.
Our patients from last time we were in New York were already booking their May appointment dates. So if you're looking for an appointment then, make sure you reach out right now.
And so for her, we just want to keep maintaining. Yeah, go ahead.
Can you do this if you have very thin skin?
You can actually. It just needs to be set properly. Thin skin can be because of age. It can be because of lost volume. It also can be because people have lost a lot of weight or they had some damage before, whether it's lasers or chemotherapy even can thin the skin, radiation, etc. So there's a lot that we can do, especially skincare wise. Bring this guy a little closer to me.
And for you guys who are just joining us right now, we are doing our halo laser right now. After this, we're going to do a profractional spot to give her some more deeper and more longer lasting results for collagen stimulation and resurfacing.
Exactly. She always does so well with it.
Can you do this on a skin type 5 or 6?
You can, but very, very, very light. And you have to pre and post treat with a very specific regimen. We would not be able to do the profractional laser. We would have to do it if we did it very light. It may not even be substantial. Dark skin like that, we need to see you. Tell them how to get the consult.
Guys, if you need a consult with us, send us a DM, full name, email, and phone number. Someone said, what if I have rosacea?
Great treatment for it. We could add in BBL and get an even better result. My Aerify kit right afterwards from emeragecosmetics.com treats rosacea unbelievably. Jordan, we have a lot of pictures online for decreased redness. Even you had it, right?
Even I did. I tried it. It was really great. I used it just by itself, and then I used it after a laser, and the results were even better.
He did it after adding a Pico device. All right, so now we're gonna do your nose. You can see all the dead skin cells on here. That's all come off from the surface. We're gonna wipe that off now, clean that off, and we're gonna get her nose now. Her eyes are still covered, you guys, because we are going to be doing one of our favorite treatments for eyelid tightening, plasma pen. But we have a surprise. Dr. S in the back, he's here watching. He's our facial plastic surgeon. He's going to be doing surgery at some point. But for me, as well as our clients, we combine upper bleph with the plasma pen. Have him tell you what an upper bleph is. What is it?
Dr. S. Tell
Hey
us.
guys, so lovely patient. She is 40 years old and we started noticing that her upper eyelid skin is starting to hood. So her friends are asking her all the time, like, you look tired or you're not sleeping enough or distressed. These are common things despite the fact that she eats healthy, takes rest, sleeps appropriately. But as you grow older, the skin and upper eyelid starts to hood. So we're going to do an upper eyelid blepharoplasty or an upper eyelid lift, where the skin is very, very meticulously removed, and the scar is in line with a crease that's naturally existing, called the superficial crease, which is a normal eyelid crease. And we'll show you more results from the surgery. She'll be asleep for it, she won't feel anything, and she'll heal within a week.
Right.
So the cool thing about that, so we just finished Halo. Come take a look. So the cool thing is, we have Dr. Stan in here, and we can do surgery at the same time we do laser. So our next treatment's going to be upper black laser, which would be great. I'm going to do that this year. Look, you guys, it starts to sag a little bit. This little bit sometimes just needs to be, a sliver needs to be taken off. That's all we need to do. So right now, you guys can take a look. She has a little bit of inflammation. There's all these little honeycombing, all these little spots on here. Those are all going to peel. But now we're going to do our stronger treatment. We're going to do our profractional, so we're setting that up.
Someone wanted to know if you can skip subcision with doing Halo.
Not my choice.
And they're a doctor asking me.
If you need subcision, do the subcision. You have to do a consult. Tell them how to make that.
You guys, for consult, send us the DM full name, email, and phone number. And if you were the doctor asking that question, send us a DM. We'll get you in contact for training.
So it's going to be a couple seconds while we switch.
Another person's asking when is the next time we'll be in New York, guys. We're going to be there in May. It's already filling up. Send us a DM, full name, email, and phone number. We'll reach out to you. So you guys, we're just switching over hand pieces right now. We're not going to show you our device or our settings.
Switching over so we can do profractional. I'm going to mark for her really quickly because there's some areas where it bothers her in terms of the scarring. My focus is really going to be getting her kind of all throughout the whole cheek area. So we're going to go this whole area. I don't want her to skimp on it. I'm going to go turn your face. Perfect. So we're going to mark. I'm just going to take a look. Perfect. Okay. So that's going to be our treatment area. And you guys can see there's some little areas here on the upper cheeks, on the lower part, and then overall blending. So normally, okay. All right. Yeah, perfect.
Plug it in.
I know. What questions do they have?
What questions do you guys have? Guys, face, body, any of them? Let's hear them. We have what?
Let's talk about face.
Let's talk about face, guys.
Profractional is getting set up. We're customizing it to the type of scars that she has.
Someone wants to do a fellowship with you. Send us a DM, please.
You want to do a fellowship?
They're a derm.
Info. If they're a derm resident, they're going to have to send a resume for a fellowship. The past 2 years, I haven't taken a fellow, but I would like to. I'm just very picky. No, I'm good now. Time depressor. Time depressor. All right.
What can you do for extra skin under my eyes? Filler or question mark, guys? We have several treatments. We have our plasma pen. We have our blepharoplasty. We have our plastic surgeon with us.
So you guys can take a look. The under eye skin depends on what is needed. If it's skin only, we're gonna start now with the profractional. And the skin only, laser is probably going to be the best choice. If there's fat paths or volume loss, we need to do surgery or repositioning of the fat or fillers. So now we're doing our stronger pro-fractional. And you guys can see this is much stronger. It has a lot higher of a density. How do you know? The yellowing and all the little dots. We have thousands of little dots being created here for the texture. You're doing great, I know. Give her a little squeezy ball maybe. Oh, okay, good. Got it. Perfect. So we're doing a little more concentrated in problem areas. This area she's gonna feel a little bit more. You're doing good, you're doing good. Not too much longer. Bring it back to the center. You're gonna need a gauze. And you guys could see erbium is much deeper, there's more bleeding. So we cover and we treat. She's doing great though. This is gonna give her much more. Now there's some level of tightening with this because this is an ablative laser, but because it's fractional, it's less. You guys have seen me do contour before, which we should have updates on the stories. I'm hoping by tomorrow for our other patient that did contour last week. We need that. I got this, I got that. So I hope our team is doing that so you guys can see and follow up. So a little bit stronger. I'm gonna do one more row out here. She's a really good candidate for this stronger treatment. She's got lighter skin tone and she follows all the skincare protocols, so she's prepped for treatment. Good. All right, one more row.
So there's a lot of bleeding for a laser?
Yes. This is normal for this type of pro-fractional. Not everyone gets this pro-fractional, this level.
Does this remove dark spots?
Yes, a lot of them. So now we're going to switch the setting to blend on the edges and get some of those other stars.
Is she numb? Of course our patient is numb, guys. We do not want to hurt her.
It's going to be a little bit quicker. Still the same level. You're doing great. We're almost there. Deep breath. Yeah, we're literally painting away stars. Good. Almost there, okay? One more minute on this side. Doing really good. We're close. And she has some deeper scars down here. I'm doing a little bit of an overlap. Good. So close. I know. Hold on. Need like 3 or 4 more pulses, okay? I'm sorry, man. Good. 2 more up on the lateral cheek. Here we go.
Why is this combination treatment better than multiple visits for RF?
You got to consult with us to discuss what's better for you. I don't know without seeing your skin.
Someone never sees us doing this on dark skin.
Well, we do it all the time. We did it in New York. We did it in New York, Jordan, remember? PCA Halo. Okay, beautiful. So this side's done. Hold this a second. Wait, ice pack? I got it. See the ice pack, please. So we're gonna give her ice on this side. And we're gonna start with the other.
What's the name of this laser? This is our Cyton Profractional. It's on our Jewel X
The other side
platform.
we're done, okay? Now I gotta do plastic. We're good. Well, that's not
Almost
so
there.
bad. It's not as bad. A little deeper this time, a little higher density in some areas. You guys can see all the little dots on there. It's going to be a nice improvement. All right, I'm going to give you right hand. Give me your right hand. Hold the ice right there, okay? Turn all the way to the right. Like that. Okay, let's finish now. Okay. Now we're going to blend, again, the lower part. Here we go. Bear with me.
Is oily skin more likely to age faster than dry skin?
No, actually, that's a very good question. Oily skin actually prevents aging, and it's very important to keep your natural oils balanced on your skin.
Right, how much is the cost? Guys, send us a DM, full name, email, and phone number.
Doing great. We're almost there. This hurts less than a CO2 laser, but it's still painful. You're doing really good for it being this level of a treatment. Good. Okay, hold on. Okay, almost done. We do the sides here. Turn a little more to the right. Okay. Keep to the right, to the right. Doing amazing. Okay, so now we're going to change our setting. A little bit more heat.
Hi, doctor. What exactly is this therapy?
Tell them.
Guys, this is our Cyton Profractional laser right now. We're going to help stimulate long-term collagen production. We're going to help wipe off some deeper acne scars and textural concerns for our patient.
This could be used for tightening as well as major sun damage. Mapped out where she has her deepest scars.
How many sessions are usually required for acne scars?
No answer for that. It's all based on what you have.
Another doctor is asking if you're single, guys. Send us a DM with inquiries.
A doctor? I don't know if I'd want to date a doctor. Yep, send in your resume. Send it to Jason Emer Official. We're almost there. close. Alright, you guys, we're finishing up now this. We will do plasma pen soon, and we will show you the result of that pretty quickly. You'll be able to see that great treatment for eyelid tightening. Stay tuned. Bye.